Okay, I would like to now introduce Liliana Quintero. Liliana is a public health researcher and curriculum developer, as well as our executive director for the Northern Indiana Hispanic Coalition, where she has had that role since 2005. She has been a passionate advocate for Hispanic health equity and addressing social drivers of health. And among her leadership and accomplishments, she's won numerous awards, including IUSB's Unsung Latina Heroine, the American Heart Association's Heart Hero, and the YWCA's Woman of Service, along with the city of a key to the city of Elkhart. So, Liliana.
Buenas tardes a todos. ¿Tenemos hambre? Are we hungry already? I'm pretty sure that we're hungry. Let's start with our presentation. I wanted to say thank you so much to our board researchers, Dr. Jean-Marie, Dr. Place, Dr. Weaver. All the insights are helping us to really move in the right direction, I hope, with so many excellent providers that we have right now. So that is going to help us to make informed decisions to improve and to move the needle regarding infant mortality. I'm going to start, and well, we have the presentation ready. Something that we were doing with all the data, as both doctors have been mentioning, is that we have over 79 different teams that we identify working during this project. And when we were working on this, we were identifying a lot of barriers, and we were working as well in a socio-ecological model. So what we decided to do with the socio-ecological model was a model. It's not working. Oh, yeah, it is working. It's a model that we use it to distribute the barriers. So we are talking about this model, we are talking about individual, interpersonal, organizational, and public policy levels. So it's like how there are different factors that can fall in each of these ones. So we talk about, like, for example, personal. We're talking about low levels of education and health literacy that everybody's talking here. We're talking about, I don't have access to nutritional food, financial instability, employment instability. How can I thrive if I don't have that minimal things solved? When we talk about interpersonal, we're talking about the lack of ability to speak or communicate in English. So then it's not affecting just me, but it's as well the frustration of the provider who is not understanding me. We're talking about social isolation. I am alone here. I don't know anybody. I go to this species because all my neighbors speak English. So how can I thrive when I am living in that situation? When we're talking about organizational, we're looking at lack of Spanish-speaking providers. You know, our excellent colleagues that say that. You know, if we have providers who speak Spanish, that trust that Mrs. Green was mentioning before will be built the right way. You know, because at least the language is not in the middle. Poor or complicated referral system. Okay, we take care for the patients for the first 20 weeks of pregnancy, and later what? You know, like I was talking to somebody recently, I say, just in mind that your family doctor got retired. Oh, no, doctor, don't do this to me. Now what? In mind now when you are pregnant and you were so comfortable with that provider, now you hear like, okay, next, we cannot handle more. You know, even if somebody's going to be in the middle, it's not the same. So that challenges are huge. When we're talking about community, perception of discrimination, of a stigma, my eye color, my accent. I was one time running a training of cultural sensitivity with a big dental office here in the area. And I asked a question. I had all the staff, it was like 40 people. And the owner was concerned because he lost 40% of his Hispanic customers in the last 6 months. He said, I don't know what we had to do, but those are the ones who feed my company. Those are my clients. So I'm running the training, and I ask a question to the ladies, to the trainer. I say, I arrived to the place. I don't open my mouth. What is the first thing that comes to your mind? One lady, me. Unpaid visit. You are going to come, get the services, and you are not going to pay for this service. The owner of the company that hired us, we need to take a break now. He approached me and he said, she's my front desk. So you can do the math. So when we're talking about community and we're talking about organizational, so how much we as owners, we as leaders are overseeing what is going on? Who is accountable? Because we know who is the loser. So what can we do? Public policy. We have been talking here and listening. We are just sharing what our community is saying. We need more access to health care. We need prenatal care. We need more benefits for maternity leave. They talk about la cuarentena. Yeah, it's 40 days, but they wanted to see my baby back in 2 weeks. If I stay 40 days out of work, I don't get a job again. So I need to have the baby and run back to the office. All that is financial instability. So what is the goal of this presentation is to talk about recommendations. What do we hear from the community, from providers, and what we can do? The first big recommendation is to institute the Promotoras de Salud model. We keep talking about community health workers, navigators, maternity connectors, but the reality is that we need a model. And this model exists since 1960 in Latin America. We started that program, and since then has been coming in the United States slowly. But the beauty of this model is that it's all around these levels. I can have my promotora de salud here facilitating Raima to understand the doctor as an interpreter. But that's why it's a model. I need the doctor with a checklist saying, those are the topics that concern me from Raima appointment. She's not taking her pills, she's in the borderline of gestational diabetes, but doctor doesn't have the time to follow up with Raima. This promotora de salud has to have made the time, and maybe the promotora is going to be talking to the doctor and say, doctor, next time I create this flyer, I already discussed with your team, can you provide this? And then I follow up with them. Why? Because trust. Because if the paper is coming from the doctor, it is important. The doctor gave it to me, even though I know the language barrier. But then for me as a promotora, it's going to be easier to emphasize. And what can I do at public policy? I can go to Dr. Weaver and say, hey, I had a network of promotoras de salud, and this is what we observe. This is what we need to do. This is what we need to change. So, but that's why for us, this study, the most beautiful part is that we hear and listen to the ones who are part of these statistics. So we really took serious every single sentence, every single word that we hear from you guys. Y muchas gracias. Muchas gracias a la comunidad hispana que hizo parte de este estudio y que nos permite compartir esto con nuestra gente. Thank you so much to every single Hispanic person who was part of this study and give us the privilege to share the results with every single provider and leader who really can make that needle to be moved. Thank you. I haven't finished, unfortunately. Okay. Remember that we said that we had 4 recommendations. The first, promotoras de salud. Second, raising awareness, increasing health literacy. We have been talking about that. The first thing that I wanted to talk about this is content. We need to develop culturally relevant content. We need topics that are culturally relevant. We talk about context dependent. Everybody's talking about that. Context dependent. What is my reality? The best example was what we heard before. You know, like we need, okay, be sure that your baby is sleeping on the bed, on the crib, avoid this, but Is this appealing to the person? Is really the doctor knowing what is that problem with the family? It has to resonate with Hispanics. Maybe they are not eating healthy. Okay, so let me give you at least this paper that is going to be telling you how to eat. And the paper is talking about maybe mashed potatoes and things like, this doesn't resonate to me. But if you guys are talking to me like, hey, you need to switch from a flour tortilla to corn tortilla. Oh, you're talking my language. Okay, now I got it. So this is also a grain, and how many grains of grain, how many grams of grains. So now I got it. But it's resonating to them. We're talking about adapts to patients' health literacy level. I was interviewed recently with ABC News, and I was explaining to them, say like, I can speak English perfectly, but if my last level of education was first grade, and you bring me big words like preeclampsia, it's like, what? But if I don't have the trust, I'm gonna say like this, right? And I live away, and then nobody is going to address that problem. I say like, the doctor said that it has something like pre something. I don't know, but I don't think that is concerning. So how we are developing that content that is appealing to them. We need to think about channels, because it's not just to have that video. As Dr. Weaver, the first thing that she says is like, I believe in graphs. I like graphs. We are visual. But we don't want a long paragraphs. We have something that is going to help us to understand videos, visuals. So then once we have all that developed, how can I distribute it? What Dr. Johnson say? Hispanics love digital communication, Facebook, TikToks, right? WhatsApp. So how can we develop that? How can we make that accessible so really the message doesn't stay in just a video in my computer? And now messengers. Who is going to pass that message to my community? Who are the trusted messengers? Is the secretary, when I am checking out, giving me all the papers that is going to gain my trust? No. But if the doctor gives me that paper, even though he doesn't dedicate quality time, and say, pay attention to this paper. Call if you need help, because this is fundamental. It's completely different. Who is the messenger? Informal networks. Doctor mentioned, we need to help our community members to strengthen that informal networks, family and friends. How we can share that information with all of them. So then we can apply other techniques that we are kind of like after reading a book, everybody's in the same page. So we don't have to go to Dr. Google. That is the worst sometimes for situations like what we face. And again, promotoras de salud. This is what we are looking, somebody who can follow our patients all the way through to guarantee that success. We need to expand. I already have this, I have the trusted messengers. How can I expand that education and resources services? So we need to make that knowledge broad, accessible. We need to have in-depth education. They mentioned already, we discovered that we need more education in sex education. Help me to talk to my kids about sex. Help me to talk to my kids about sex without affecting our religious beliefs. How can I bridge that, how to build that bridge that I can be still Catholic, believe it or not, but that topic cannot be ignored. The third one, advanced health integration. We're talking about accessible services, but in a way that is in-house services. Maple City already mentioned, we had the patient, we identify maybe some postpartum depression. We can connect immediately that person. Maybe the person is pregnant and is showing gestational diabetes. Okay, you are not gonna live today without learning how to use I was gonna say pedometer, a glucometer, small things like that. Provide social support groups. I don't have to repeat, we hear it very well today. Promote continuity of care for pregnant women. So we need to ensure continuity and coordination for our pregnant women, because it's not to continue. Again, coordination, who is helping that with that glue? Promotoras de salud. We need to have that ladies that is going to guarantee, they cancel my appointment, the doctor has an emergency, and now what? I need to be seen by the doctor now. Increase access to providers. So we are talking about mitigate that provider shortage for low income and uninsured patients. We have limitations, huge limitations. But how can we create that glue that if I'm not taking patients, it's not saying like, I am not taking patients, no, but call this number, but try this phone, but try this in St. Joseph, call me back and I will be connecting you with a provider. Not having a prenatal care visit in the first trimester is one of the main reasons when we talk about infant mortality. So we cannot leave that unattended. Spanish-speaking providers, we already talked about that. The more we have it, the better. And our last one, based on what Kimberly asked, was the importance of creating that relationship, patient-provider, with trust, flexibility, and empathy. The key word is trust. We need to use effective patient-provider communication techniques. We already talked about motivational interviewing. We need to do that. If I had the trust, I can learn from my patient that maybe there are five people living in one room, so it's no space for a crib. So what I can find as an alternative? Maybe I can learn that I don't drive. My husband works until 3 o'clock, so the appointments at 3 doesn't work for me. How can I listen to my customers? So then I am proactive as a provider and say, I write a note. In the same way that we have in our companies the software for fundraising, do the same with the patients. Be aware that this patient needs always appointments after 4. So then I feel listen. Doña Maria, yes, you mentioned that your husband worked. The next opening at 4:30 is, however, I'm going to put you in the waiting list. My gosh. Now she doesn't have the trust just from the doctor. Now she trusts to that receptionist, that secretary, say, oh my gosh, I am important for somebody else. But it's small little things when we're talking about motivational interviewing. Teach back. As you can tell, and my accent, I think that is clear that I was not born here. I'm from Colombia. And I love when I am doing appointments in Colombia. I finish, and I wanted to set an appointment with doctor, this. And the next question that the person asks in the phone is, can you repeat it? I say, what? Yeah. Repeat, when is your appointment, where, and what is the doctor? Look at how simple that. Teach back. So just the appointment, imagine the rest. Imagine we are talking about gestational diabetes. They are talking to Areli. Okay, Maria, so you understand what I'm talking about here, how serious it is. What did you understand? What is diabetes, gestational? Oh, can you repeat again? Look at, we opened the opportunity because the person was just nodding. I was not understanding, was not digesting that information. And on top of that, I'm nervous, because they say, oh, I'm going to die. No, so and maybe we find alternative opportunities to talk about that. Adopt flexibility in scheduling. We already talked about that. I know that it was a lot of controversy. I remember my research team and say, we cannot say that we cannot create a penalty among the community when they don't show up. We cannot use that as spots that could be used for other patients. What is the difference in that two concepts? Transparency. From the beginning, if I am becoming a patient of the place ABC, please, please, please be aware that we have limited resources. So the sooner you let us know that you cannot be here, we can open that spot for somebody else that maybe could be you in the future. But it's transparency. But how many of us do that? How many of us recall or remember that, to the people? And it's not with a cold text message. Nah, that is so cold. I keep receiving text messages here from doctors like, but it will be cool that it's a warm phone call, a friendly reminder, you had this. Then you say, oh, yeah, because I could be the one using that. Cultural sensitivity trainings. I love what Areli was mentioning. Here we are talking about, again, what I mentioned, how we can run that and respect religious and traditional beliefs. Your appointment is tomorrow with Dr. John Peterson, and the husband is there, and they're gonna say this, but we didn't ask why that person didn't show up to the appointment, because the husband is masculine, he's macho. I don't want that my wife is gonna be touched by a guy. But are we opening the opportunity? Maybe, do you have any preference? We had Dr. Maria and we had Dr. Juan. You see, it's listening. I'm not saying that we are assuming, but it's that conversation that is going to make a huge difference. Maybe a lot of us as a Hispanics, we don't even know that we can switch doctors. Right? Why not? Hey, I don't feel comfortable. Or how was your visit today? But I wanted that you mean it. You know what I mean? Like I was talking to one of my friends that first time came to the United States, and they say, how are you doing? And, and I start explaining like they walk away. It's not like, don't do it just for doing. How was your visit? It's like, listen. How was your experience today? I was like for 1 hour in the waiting room, and I just got 1 hour permission in my job. Do you need a letter? That kind of things. I'm going to turn off our patients to be consistent in these doctor's appointments. And then you wonder why you seeing people arriving late sometimes. I was in a conference in Texas. It was interesting. And it was a speaker from Scotland, and the guy say, in Europe, they are giving late fees to the patient and late fees to the doctor. You need to respect my time too. You are making me wait for 1 hour. What can we do? At least as a minimum, say, I'm so sorry that you had to wait for me. I don't have any idea how many times the doctors really know at what time was the appointment for me. So at least you give me time to plan ahead. I have another 2 kiddos that I'm paying $40 per hour for a babysitter. So how much are we listening? Are we going to be able to solve the problem? No. Yesterday, one person in the radio was interviewing me, and he said, do you think that what you're going to do tomorrow is going to change anything? But it was in a, you know what I mean? He mean it. He mean it. And I say to him, I know that our community is rich of great professionals, and I know that Indiana has a wonderful leader for health. And I know that if we have data, they love to make decisions based on data. And that is what we can provide today. The opportunity for you guys to make informed decisions using this as a source to really move the needle. We are more than happy to help and work with every single organization here. But the trust and the ears that we have from our Hispanic community is our main asset. Here, the last 2 implemented regular check-in methods. How many people really call and see, how are you doing? Call. I know that they say, who is going to pay for that? What is cheaper, to follow up with that woman that maybe left the doctor's appointment dizzy, or to make that phone call? And here we had teach patients about how the US healthcare system works. We don't know how the health system works. Even myself. You had a mammogram, you spent one bill. No, here is the bill from the mammogram, the bill for the one who read it, the bill for the it's like 4 bills, isn't it, for a mammogram? And you start thinking like, oh, this is a mistake. How much we as a provider are taking the time and say, Liliana, just to let you know that you're gonna receive 4 bills for this. So then I know transparency, trust, transparency, listen, help me to understand. And this is the financial concerns associated with social drivers of health. We are talking about transportation. We know of places that provide gas mileage reimbursement for relatives who bring patients to the appointments. Do we provide that information? Did you know that? We had places, community non-for-profit organizations that provide you with gas gift cards for doctor's appointment. The Medicaid covers some services to go to appointments, but are we saying that openly? If we are talking about financial assistance, do you know that if you pay up front, maybe you receive 50% discount? If we don't make them aware, how can we succeed? In our countries, we bring the money for the doctor's appointment, so take it. Don't tell him, oh, you're gonna receive a bill later. No, that is an extra money that you can collect instead to be later sending bills and bills and bills. So we can make a difference. Things like a MD Save to reduce patient costs. I don't know how many of you guys are familiar with MD Save. For its reasons, and right now with the health insurance, the company, we lose the health insurance, so now with the, how you call this, the marketplace. My daughter has a very sensitive need surgery. If I will get my appointments for her therapies with this marketplace was going to cost $220 per appointment. MD Save is a web page, is a company that helps you to identify its miles around you, what is the provider, and how much. It's not like sending you to second-hand providers. It's to places where you wanted to go, St. Joseph, Goshen Health, Beacon, but openly say each appointment is $80. It's a win-win because that money goes to the hospital. So how we can make people more aware of that? The other one is expand Medicaid and pay leave that we're talking about. I am glad to see Randy Christopher now in the room, but that is a conversation from Goshen Health. A conversation that we had having about the importance of creating a voucher. And I know that that is a conversation that we had with Building Stroke Brains, Beacon, all the hospitals. How we can protect our babies, but not wait until they get born, since they are in the belly of our mothers, no matter what is the status. Those our babies are American citizens. So why do we have to crucify them with services for maybe $4,000, $5,000 in prenatal care that is going to guarantee a successful baby born, thriving in this world? So these are the kind of recommendations that we have it, we're discussing in our group. I know that a lot of what I am saying is touching thick skin, but I think that has to be said. And as I say, everything that we're saying here is based on data. It's data and information that many of you share with us. And I don't want that you leave today without our research document that has all, like executive summary of what we are mentioning here. But we really appreciate your time, and I think that we are open for maybe a couple questions before lunch. And I know that we have little short time, but if anybody has a question.
Thank you so much. This has been some really great information, so I appreciate all the work that you've done. I just want to mention, since we have this last slide, I work for the Center for Healing and Hope. I'm a social worker, and I want to let people know that we have an immigrant resource fund. And so that's for people who cannot access help from the government, cannot access help from other places because they may not have a social security number or something like that. So we have an immigrant resource fund. I also have access to volunteers who provide transportation. So let me know if you are needing some transportation. I also want to say, we also issue the Goshen identification cards. And so I'm in the previous presentation, I think IDs was brought up. And so we offer the Goshen identification card, which has your address on it. And women can just have that in their wallet, and that's all they need to carry. They don't need to go searching for a piece of mail to show that they live here or there. They can just have that ID with them. So I just wanted to bring that to your attention at the Center for Healing and Hope in Goshen. Thank you.
Okay, I think that we don't have questions, but we're going to be here for... Oh, we had a question here. Gaby? Translation.
Buenas tardes. No hablo inglés mucho, pero espero que alguien pueda
So, good
traducir.
afternoon. And as you notice, my language is Spanish, and my first language is Spanish.
Yo soy mexicana, apenas estoy por cumplir 2 años aquí en Estados Unidos.
So, I'm Mexican, and I have about 2 years here in the States.
Hablo un poco en cuestión de la comunidad hispana porque sé que todos somos diferentes.
And I would like to say some few words in regards to the community, the Hispanic community.
Más que pregunta es un agradecimiento porque nos brindan este tipo de pues información de diferentes centros y ayudas que muchas veces no tenemos idea que existen.
So, more than a question, I would like to say thank you for these type of events where we can receive so many information about resources that are available for us in our community.
Yo en México soy licenciada en Educación Física y Ciencias del Deporte.
So, I have my bachelor's degree in physical education as well as in art.
Y estoy actualmente embarazada.
And at this point, I'm pregnant.
Pero quería también mencionar que algunas de las diapositivas que mencionó de la importancia de estar al tanto de las personas, sí es muy importante porque a veces también, aparte aquí del aislamiento social, sufrimos el aislamiento familiar, que en los hispanos para nosotros es muy importante.
So I could say that all the information that we have reviewing, the presentations is very important. All that factors, that can attribute, in a negative way during pregnancy is important to consider. But also the isolation. Sometimes a Hispanic, you isolate from the rest.
Y pues también entiendo la dificultad para ustedes que tienen que acoplarse a nosotros.
So at the same time, I understand the difficulties, that you also face because you had to adapt to us at the same time.
Pero aún así he tenido la fortuna de involucrarme con personas que me han ayudado bastante.
But even then, I have been very fortunate to find people that have been able to help me.
Y pues es más que nada eso, la importancia del agradecimiento y que pues tal vez alguna, no sé cómo mencionarlo, pero que pudiera haber tal vez algún programa grupal tal vez, donde podrían a lo mejor tomar un poco más en cuenta a las personas que están embarazadas para hacer tal vez un poco de actividad física o alguna cuestión social para poder ayudar con cuestión psicológica, física, como lo mencionaron de la diabetes gestional, preeclampsia y demás, porque en cuestión de esos programas no he escuchado mucho.
So I think like two main things, like the importance of being thankful, with the people that are helping you and all the resources that are available for us in the community. The second is like maybe the possibility of the creation of support group, maybe thinking like having a group where other pregnant women can be part of it, and then you can touch base on different topics such as like physical, so people like in pregnancy needs to exercise, and like issues that were mentioned before, like preeclampsia or something else.
Sí, más que cuestión tal vez salud de pastillas y juntarnos a hablar, hacer algo para evitar o atacar el problema. Por ejemplo, salir a caminar, hacer ejercicio grupal, o sea, algo más físico, hacerlo más realidad.
So more than just receiving the information, it will be really nice to have like a workshop, like where you can like have like hands-on and not just receiving information, but to actually, like conduct activities.
Sería todo de mi parte. Gracias.
I think that will be
Thank you
it.
so much.
Thank
Muchas
you.
gracias. Gracias por el comentario. Thank you so much.
Gracias.
And I think that for time purposes, so I invite you guys to let's take a break for lunch. We had lunch over there, so it's gonna be like different sandwich. I invite you to grab your lunch and let's come back here at 12:30, so we can start the panel, please. And don't worry about the raffles for the $50. They still go, so I know that my friend Chen is going to be doing that for the last 2 presentations that are pending. So you keep evaluating us, that is going to make us better. Thank you so much.